We have the momentum, but we're not going to win this fight unless all of us are actively involved, unless we make sure that every American recognizes that health care is a right, not a privilege.
Anna Kasparian was a sort of host of the Medicare For All town hall. What were your thoughts?
I thought it was an important discussion, and I liked the format. I liked the fact that it wasn't one politician or two politicians, regurgitating talking points. You had 3 different panels that focused on various areas, and I think a lot of important questions were answered. So I loved it. I love policy, and you don't see a lot of that in the mainstream right now. So it was a great way of kind of getting past cable news and mainstream media and talking about an issue that matters to a lot of Americans.
I think as this debate becomes more serious and more sophisticated, it's going to see more and more pushback from industry, and advocates are going to have to start strengthening their own positions.
When our employees are healthy and when our employees' families are healthy, our business does better. Morale is up and productivity goes up.
Healthcare is the tapeworm in the belly of American competitiveness.
Our life expectancy is 31st in the world. Our infant mortality is 38th in the world. We have an underperforming system at extremely high cost. And this, you've heard from the business side what that does to business. What it does on the public side, you know better than me, Senator, but in my state, Massachusetts, every line item in the state budget has gone down steadily in 2 decades. Parks and recreation's down 50%, education's down 20%, you name it. Law enforcement's down 20%.
Because we're pumping more and more money to escalating healthcare costs.
52% increase in healthcare costs in the same interval from 2000 to 2018. So this is confiscation. This is healthcare taking money from businesses that need it, labor that needs it, and public services that need it.
The big problem he's always had and he's always going to have is on the costs of this. And so, to his great credit, and this is a growth in his rhetoric, I think, he did not talk about the need to tax Wall Street and to tax the rich and to find the piles of money that are in Bermuda and stashed all over and take that money and fund healthcare, because that plan holds healthcare hostage to the prospect of taxing Wall Street. You should tax Wall Street as a moral good on its own, because Wall Street needs to be taxed so you bring down inequality. But you need to decouple, I think, those two things. And this time, he didn't go all the way where I'd like him to go, which is to say something like, we're not paying for it. Medicare for All will pay for itself. The same way that it's not entirely true, but whatever. Republicans say, look, tax cuts pay for themselves.
Right.
And they sort of do, they sort of don't. And if reporters want to do the fact checking on it, then they can talk to his old economic advisor, Stephanie Kelton, who can explain modern monetary theory to them and about how the actual budget that you need to worry about is the capacity of the economy as a whole. And if the economy is growing, then you can pay for whatever you can pay for as a whole. So say it pays for itself. Medicare for All pays for itself. You're going to have more money in your pocket, and you're going to have health care. And Republicans are lying to you, saying that you're going to pay more. He did a sort of a version of that, but not quite. So what do you think about how he's been framing that big challenge that he's going to have to people who are like, well, I love it, but we're all going to go bankrupt?
Right. I think the economic portion of this discussion was the part that really spoke to the majority of people who are interested in this debate, because people are worried about how much it's going to cost. They are worried about their taxes going up. I hear what you're saying, and I think you're ultimately right in, using a strategy that doesn't constantly attack Wall Street and the big banks. But, my gut instinct and
which is good too, but you do that because it's good on its own.
Yes. But it is, I think he could possibly do a better job in framing it in terms of how much money we waste in preemptive wars, in intervention, in conflicts abroad that we have no business interfering in. And by the way, that is a talking point, well, not a talking point, but that is an ideology that actually speaks volumes not only to those on the left, but also those on the right who supported Trump because they don't want to be they don't want to intervene in conflicts abroad. So I think that might help. But I also really love the fact that he talks about the offsets of the costs. Should our taxes go up to pay for a Medicare for All system, we're not going to have copays, we're not going to have premiums, we're not going to have deductibles. It's not going to be this complicated, confusing system. system, it's going to be simplified, and at the end of the day, we will have more money in our pockets because we don't have to have these ridiculous costs for the healthcare we need.
I love your point about talking about the wars, because it actually goes back to the same point about can we afford it? Because nobody ever said before we went into Iraq, can we afford this? No one asked that. Said, well, of course we can afford it. We are the richest country in the history of the world. We can, if we want to invade a country for no reason and spend trillions of dollars doing it, we can do it. We'll run up the deficit, but that doesn't actually slow down the economy. The deficit is just an accounting tool that keeps track of how much money is on the government side, how much money is on the private side, and don't worry about that. The question is, what should we be doing?
Exactly.
Should we be going to war, or should we be providing health care to? And if you talk about it that way, you're right. Nobody asks how you're going to pay for these tax cuts, even.
Right.
Or how are you going to pay for the war? How are you going to pay for all of these other things? You know what? If we can afford war, then we can afford the health care.
They can't comprehend a system where most of the costs are borne by individuals and not the entire society. In France, when they talk about their system, they always use the French word solidaire, which means solidarity. Their system is based on principles of solidarity, that the weakest person in France must be guaranteed care because otherwise the country cannot be strong and functioning.
What is the most cost-effective way to do it? And I think all of the evidence suggests that a Medicare for All single-payer system is that way. We don't have to invent Medicare, we have it. And as I mentioned earlier, it is a popular, effective program. Unfortunately, it only is applicable to people 65 or older.
Republicans, they can't argue really on the merits of the single payer itself, because every polls show that everybody loves it. So they have two challenges that they can make. Your taxes are going to go through the roof, or you're going to drive up the deficit. And in some ways, Sanders leans into the tax side. He says, yes, your taxes are going to go up a little bit, but the overall amount of money you spend is going to go down. And that's a good argument, and also there's some nice social responsibility to it, and there's some authenticity and some honesty that, look at this guy, he's saying this. On the other hand, he could just as plausibly say, we're just going to run up the deficit. And you can run up the deficit because the deficit doesn't matter. Every time throughout the course of our history, when we have paid down our deficit, we've gone into recession. Like, these people that are telling you that the deficit's a problem are stupid, and they're lying to you because they're trying to get rich off of you.
Yeah, I mean, look at what the Republicans are currently doing to the deficit when Democrats are in office.
And it's not going to hurt the economy. It's not. They're going to benefit from it.
That's exactly right. And so the only people that make a huge deal about the deficit are Republicans when Democrats are in control. And then as soon as Republicans are in power, forget about it. Well, who cares about the deficit? What's the big deal about the deficit? Yeah.
And Democrats kind of get tricked into caring about it because they don't like the hypocrisy. It drives them crazy. And so then they get trapped. And so that when they come back and they want to spend money on actual social programs, then they'll play tape of them during the tax cut debate talking about the deficit.
Exactly. What we need is Democratic lawmakers with backbone. And that's what I see with Sanders. You can tell that he's not bought by pharmaceutical companies and massive corporations, and actually looks out for the best interests of his constituents is inspiring. And we need to elect more people like Bernie Sanders if we really want a Medicare for All system to come to fruition.